Hello and welcome to HSM 375. Today we are going to be discussing healthcare data security and regulation. They are three learning objectives that we have for today's lecture. The first is defining what data security and data privacy is, but we're going to talk about it as it relates to healthcare. We're also going to identify best practices for the use and disclosure of protected health information. And then lastly, going to describe a couple of data security laws and regulations, both in the US as well as internationally. So, starting from the first learning objectives, just a kind of have a bit of an overview about what the health data and security and privacy is. As healthcare providers, as healthcare professionals, we have the responsibilities of protecting the privacy of our patients alongside providing quality healthcare. So, this is to say that should your role as a health professional or an organization's role as a healthcare provider does not take serious accounts protecting their patients' privacy, it doesn't really matter how great the quality of the healthcare that they're providing to their patients, because both has to be given the both they both carry the same weight when it comes to our responsibilities as healthcare providers. One of the term you're going to hear often when it comes to patient privacy is you're going to hear terms like protected health information, and in loose term, you could say is an individual most sensitive, valuable, or private data. This is not to say that this is information that is bad, or let's just, for example, something that is shameful that you want to hide. Not necessarily. Even if it's the most innocuous health information, it is considered a protected health information, so long as it's something that during the exchange, your interaction with the healthcare system, you as a patient is providing that information to the healthcare provider. That becomes a protected health information. So there are very strict guidelines that are in place on how healthcare providers are to handle protected health information, how they are to use protected health information, as well as how they are to, transmit those information, either and interaction between their devices within their network, or even in terms of who they're sharing the information with, in terms of how they're sharing it. So these are all things that there guidelines exist for how to do that. And violating this guidance, these guidelines does come with penalties, sometimes fines. And this is not even it's not even when you are intentionally violating the requirements. Even if it's completely non-intentional, you could still be subject to these penalties and to the fines. So some of these data protection requirements, you have the HIPAA, which is the US. I have included a link here. So, you guys, you want to kind of do a little bit of a refresher reading about that. That has that. And then you have in Europe, the HIPAA equivalent in Europe is the General Data Protection Guidelines, which does not cover exactly the same thing that HIPAA covers, but they do have similar responsibility, which is to protect the data of patients and those who use who are generating personal information. So, to define what privacy is, data privacy and data security is, you can look at data privacy as kind of respecting the requirements that patients have kind of set out to say this is how they want their data to be used, this is who they want to be able to access their data, and this is for what purpose that they are comfortable having their data to be used for. So that would be data privacy. In terms of when we're talking about data privacy, that is the scope of it, in trying to make sure that these requirements have been set out by the patient understands what it is, and that we as healthcare providers and healthcare professionals respect the requirements that the patient has put forward. On the other hand, patient security is more of technical in terms of how do we enforce those privacy constraints or regulatory constraints, in to say this, how do we make sure that the patient privacy stays privacy, because of all the devices and informatics goes into the healthcare system, is kind of on that sense. So privacy and security is like the two sides of the same coin, in the sense that privacy focuses on the policy end of it, trying to make sure that we come up with we come up with things, we say parameters, this is what this means and this is what this means, while security is more on the technological side, just to make sure that what has been those parameters that are being come up with gets enforced and they stay true to it. So that's a way of understanding how data security differs or is similar to data privacy. So, another term you're going to come across when it comes to conversations about data security or data privacy is sensitive information. So, this is a term that is kind of used specifically to classify terms such as protected health information. Actually, what protected health information, and I've included a link to that, is there are 18 elements that have been identified by HIPAA to say this is the information that we are protecting under HIPAA. This is to say that it's not all information that is related to a person that is actually protected under HIPAA, but these are specific information, and this is those that have been listed here in this link if you go to it. And then we have individually identifiable health information, which is also known as personally identifiable health information. So these are a lot of the personal information that is not covered under HIPAA as protected health information, but can be used to identify a person, especially when used in data, when used in research. While they are not strictly considered protected health information, there is enough information about a person who owns this information that they can identify who this person is. And when you have the IIHI along with the HIP, you can make a like complete identification of whose information is. For example, if you can be talking about, this person has let's just, for example, this person has a high glucose level, and you could just say that, but once you mention the gender of the person and the location of the person and the age of the person, is very, very easy to narrow down who you are talking to. So their diagnosis, their medical diagnosis, is under protected health information. Things like demographic information fall under individual identifiable health information. When you have both of them, you can literally know who it is that that conversation is related to. So also under sensitive information is personal information. That's just, for example, your home address or your phone number could go under personal information, as well as your credit card information. So whether a an information is falls under HIPAA's protected health information, or it is a, individually identifiable health information. Those are all information that we as healthcare professionals should still handle with caution when it comes to delivering healthcare. In the general routine of delivering healthcare. So it's something to kind of pay a lot of attention to. So how do we as healthcare providers treat this sensitive information with care? This is an image that you could look at. You can see in this picture, you see the healthcare provider professional who is talking to the patient, and the patient has their what we can assume is the family around them, and there's a little boy who is laughing, probably doesn't even fully understand what the healthcare provider is saying, maybe because it's talking about incontinence here. The little boy may not necessarily understand what it is, but just for the fact that this is laughing can give some kind of discomfort to the patient who would not have wanted that information to be shared. So these are some of the things to consider when it comes to us as healthcare providers and how we are handling patients' information. So data breach happens a lot. Data, the privacy of patient data get breached a lot, and some of that could come from security lapses. But these are all things that one should be mindful of, and you see that some of it comes with strict penalty. You can see that this Tennessee insurer paid 1.5 million for data related violations, and this was related to Blue Cross Blue Shield, and this was in 2009. So it's not uncommon for data breaches to happen, but just because it happens, which may be in error, does not mean that there are no severe consequences as a result, and some of it can come in financial penalties. So where are these breaches coming from? You have some of it coming from the very, very commonly coming from the healthcare system itself. You have it could be coming from medical services that patients are receiving, coming from the insurance with their health plans. It's coming from electronic records, electronic medical records, coming from human resources, from research with the devices. So basically, this is not an exhaustive list, but it kind of gives you an idea of all the multiple places where patients' privacy and protected health information can potentially get breached, and then be released in the public and cause all of the security challenges. So that's something to kind of be mindful of. But it's not just only this ones that I mentioned. Some of the security breach happens from the patients themselves. Unknowingly, patients can potentially create situations in which they knowingly um, let their protected health information be carelessly stored in such a way that it could be very easy to breach. And a lot of that comes especially with wearables. When I say wearables, I mean in terms like your Apple Watch. You have your Fitbit, which is very much very, very common. These days, almost everybody has some form of wearable that they are using. So, this information, the health data that are stored in them, some of the times it gets uploaded to the cloud. And if there's any breach in the patient's devices, or even in the system that they are using, all the information that is stored on their phones, or all the information that's stored on their wearable can become, the security of them can become breached, and it will be, the information, their health, protected health information could potentially be out there in public domain, and that they do not want that to be. So that's where we end with the first learning objective. Just come back and watch the video where we'll tackle the second learning objectives, which focuses on the use and disclosure of protected health information. See you guys in a bit. Bye.